Imagine a condition that affects millions globally, yet remains largely under the radar. Welcome to the world of sickle cell anemia. This inherited disorder alters the shape of red blood cells, transforming them from flexible circles into rigid crescents. These sickle cells can obstruct blood flow, causing a ripple effect throughout the body. From fatigue and pain episodes to frequent infections and vision problems, the impact of this silent epidemic is far-reaching. Despite its prevalence, many of us remain unaware of the symptoms and complications of sickle cell anemia. The journey of a patient with sickle cell anemia is filled with challenges, but understanding it can make a world of difference. Imagine a journey where the vehicle, our red blood cells responsible for delivering life-sustaining oxygen, are misshapen, like sickles or crescent moons. These rigid and sticky cells can slow or even block the flow of life's journey, causing a myriad of problems. Now picture this journey starting as early as 6 months old. The signs and symptoms vary and change over time but can include anemia, fatigue, painful episodes, and frequent infections. The sickle cells can damage the spleen, making the body more vulnerable to infections. Consequently, infants and children often receive vaccinations and antibiotics to prevent life-threatening infections, such as pneumonia. The journey becomes more arduous as it progresses. It's fraught with risk factors and complications like stroke, pulmonary hypertension, and more. The risk increases if both parents carry the sickle cell gene, commonly seen in people of African, Mediterranean, and Middle Eastern descent. The complications don't stop there. They can include acute chest syndrome, pregnancy complications, deep vein thrombosis, priapism, and leg ulcers. It's a journey that requires constant vigilance, with emergency care needed for symptoms of stroke such as one-sided paralysis, confusion, difficulty walking or talking, sudden vision changes, unexplained numbness, and severe headache. Sickle cell anemia is not just about the physical struggle. It's a battle against time, against pain, and against the unknown. While there's no definitive cure for most people with sickle cell anemia, hope is not lost. A variety of treatments exist to manage symptoms and prevent complications. Medications like hydroxyurea, L-glutamine oral powder, crizanlizumab, and voxelotor can be effective in managing the disease. However, these medications should be taken under the guidance of a healthcare professional due to potential risks and side effects. In addition to medication, blood transfusions can also be a crucial part of treatment, particularly in cases where anemia is severe. For some children and teenagers, a stem cell transplant may even offer a potential cure. This procedure, however, is not without its risks, and requires a suitable donor. The journey through sickle cell anemia can be challenging, but it's important to remember that you're not alone. Healthcare professionals are there to guide and support you. Remember, no matter how bleak it may seem, there's always a way forward. Always consult your doctor and never self-medicate.